Today we'll be discussing decreasing catheter-associated urinary tract infections in the acute care setting. Catheter-associated urinary tract infections, or CAUTIs as we sometimes refer to them, are one of the most common hospital-acquired infections. They are costly to facilities and affect patient outcomes. The purpose of this proposal is to implement interventions to decrease the use of Foley catheters and to decrease the number of CAUTIs acquired. A CAUTI is an infection occurring in a person whose urinary tract has been currently catheterized or has been catheterized within the previous 48 hours. 75% of hospital-acquired urinary tract infections are associated with indwelling urinary catheters. According to the CDC, 13,000 deaths occur annually from indwelling urinary catheters. Prolonged use of indwelling urinary catheter is the #1 risk factor for CAUTIs. CAUTIs increase patient morbidity, mortality, their length of hospital stay, and health care costs. So what we want to do is keep calm and prevent CAUTIs. At the end of this presentation, the participants will be able to identify risk factors for CAUTI, list appropriate indications for indwelling urinary catheters, insertion and their continued use, and implement evidence-based practice to decrease the risk and occurrence of CAUTIs. Every patient with an indwelling urinary catheter is at risk for developing a CAUTI. Once again, CAUTIs increase patient morbidity, mortality, their length of hospital stay, and healthcare costs for facilities. Decreased usage of indwelling urinary catheters and reduction of the number of CAUTIs should ultimately lead to better patient outcomes overall. So the question we ask is, for patients with indwelling urinary catheters, how effective are interventions such as nurse-driven protocols for insertion and removal of catheters and catheter care bundles in decreasing the number of CAUTIs in the acute care setting? In 2012, the Joint Commission approved National Patient Safety Goal 07.06.01. So this National Patient Safety Goal basically is a set of criteria that was put in place to reduce the number of CAUTIs. So basic criteria for the catheter use includes, but is not limited to, precise measurement of urinary output in critically ill patients, urinary retention or bladder obstruction, prolonged immobilization, patients that are having end-of-life or palliative care, and incontinent patients with open perineal wounds. So basically, these are the indications for Foley catheter use in the acute hospital setting. So the first recommendation that we have is the nurse-driven protocol for Foley catheters, which basically, hey, I ain't got time for
Did you pause the thing, Kier?
Oh, we got to start over.
You should be able to edit it though.
How?
I don't know. How did you edit? Because we edited like that last one.
Well, maybe I can go back and take it out. Let's see.
I remember that last one because, we did it 2 or 3 times and you just edited and spliced it and took some stuff out.
Okay.
Well, if not, just start over.